Let's move on to perinatal statistics and terminology. The first thing we need to do is just to define some of these terms. Gravidity is the total number of pregnancies, regardless of duration or the outcome. Parity is where you have a pregnancy that goes 20 weeks or longer. Let's look at perinatal losses and perinatal loss rates. This is in your notes, and we look at various concerns. We look at fetal mortality rate, neonatal mortality rate, perinatal mortality rate, infant mortality rate, and maternal mortality rate. What we're looking at with birth rate is a number of live births. With fertility rate, we're looking at live births also. But if you'll recall, a rate has both a numerator and a denominator. So we have to look at the numerator and the denominator. All of these rates that we have here have a denominator of 1,000, with one exception, and that is the maternal mortality rate, which has a denominator of 100,000. And that's an important distinction for the boards. 1,000 for everything except the maternal mortality rate, which is 100,000. All right, then we're going to look at what is the denominator in terms of total and live births. And let's just review from a public health standpoint, what are the definitions of these various terms? If we look at pregnancy as starting with the last menstrual period, it would be at week 0. The first 2 weeks until conception is 2 menstrual weeks, but recall there is no embryo because there's no conception even yet. Conception occurs at week 2. If we have a loss of the pregnancy anywhere between menstrual week 2 and menstrual week 20, we call that an abortion. Now that could be either a spontaneous abortion, it could be an induced abortion. It is any pregnancy which is lost prior to 20 menstrual weeks. Now this is the legal definition. Now conceptually and from an embryological standpoint, a fetus begins after the embryo stage is finished, which is menstrual week 10. But from a legal standpoint, if a pregnancy is lost prior to week 20, it is considered an abortus. Once it has reached week 20, if there is loss of the pregnancy or fetal death up until birth or 40 weeks, any time in this period, we call this a fetal death. And a certificate needs to be issued by the state. You have a certificate of fetal death. If there is a live birth and a death which occurs within the first month of life, we call that a neonatal death. We can combine the fetal deaths and the neonatal deaths together, and we will call this perinatal deaths. And the reason why we use the 30 days is because most pregnancy-related deaths which used to occur would occur within the first month of life. Now with our intensive care nurseries, with premature babies, we can often keep them going for many months, and it is probably not as accurate a reflection of what happened in utero, but we still use the neonatal death rate and the perinatal death rate. If there is death which occurs from a live born up until 1 year of age, we call that an infant death. So neonatal death is part of both the perinatal deaths as well as the infant deaths. You got that? So it is common to both of those. Now let's look at the denominators. The fetal death rate and the perinatal death rate uses per 1,000 total births. The neonatal death rate and the infant death rate uses as a denominator per 1,000 live births. And what they could very well ask on the exam is, they will give you numbers like this, that in any town, USA, there were so many fetal deaths, there were so many neonatal deaths, there were so many total births, there were so many live births, and then you need to calculate what is the fetal death rate, neonatal death rate, perinatal death rate, and infant death rate. Okay, this is just looking at it in a little different form. We're going from 20 weeks to birth to 1 month after delivery to 1 year after delivery. If a death occurs between 20 weeks gestation and birth, we call that a fetal death. If a death occurs to a live born in the first month of life, we call that a neonatal death. Neonatal death combined with fetal death is perinatal deaths. Neonatal deaths are also part of the infant death rates. The fetal and perinatal are per 1,000 total births, and the neonatal and infant deaths are per 1,000 live births. All right. Now, this is probably low priority, but just tuck it away in your brain someplace because it's very easy to remember. In terms of absolute numbers in the United States, the perinatal death rate is 7 per 1,000 total births. The infant death rate is 7 per 1,000 live births, and the maternal mortality rate is 7 per 100,000 live births. So 7, 7, 7. This figure shows what is the risk of death occurring as a function of the time duration since delivery. And here we have birth, the date of birth. This is 7 days post-delivery, 14 days after delivery, 21 days, and the first month of life. And what you see is the likelihood of dying is the greatest in the first day of life. The second day of life, it gets less, and then lower and lower. Most of the deaths which occur will occur in the first week. If there is survival past the first month, unlikely that anything's going to happen. A child's risk of dying on the first day of life is about 500 times greater than their risk of dying when they are 1 month old. So, when you look at the death, the risk of dying, it is the first day, the first week, the first month. Okay, when we're looking at rates, remember the denominator is going to be based upon the number of births. And this slide tells you that in the United States, there's 4 million live births per year. So if we have 7 per 100,000 maternal mortality, and we have 4 million births, how many women in the United States die because of pregnancy or pregnancy-related causes? How many hundred thousands are there in 4 million? Well, there's 40. So if we multiply 40 times 7, that means there's 280 women who die in the United States from pregnancy or pregnancy-related causes. Around the world, the equivalent of 4 Boeing 747 airplanes full of pregnant women crash every day without survivors. Now, there aren't 4 Boeing 747s that crash with pregnant women. But if you take the number of women who die every day around the world from pregnancy or pregnancy-related causes, it would fill 4 Boeing 747s. That's 1,650 women every day. Now, if you consider that there are 1,440 minutes in a day, every minute a woman has died somewhere around the world. And most of those are preventable causes. When we look at around the world, remember in the United States, the death rate is 7 per 100,000. Brazil, 220. Bolivia, 650. Look at Nepal, 1,500. Afghanistan is about the same, 1,500. Huge numbers of women who die. In fact, in some of these developing countries, 6% of female babies that are born will die because of pregnancy or pregnancy-related causes, and that is unacceptable. This is a marvelous palace built in India, the Taj Mahal, and it was built as a memorial to Mumtaz Mahal, who was married at the age of 19, who died in 1630 at age 37 from the childbirth of her 14th child. And the number of women who died as the pioneers were coming across the Great Plains from the East Coast to the West Coast was phenomenal. Women carry a huge burden of risk when they get pregnant in many areas of the world. Now, in terms of your board exam, what should you know? In terms of maternal mortality rate, the most common cause in the United States of maternal mortality is thromboembolism. That's deep venous thrombosis, pulmonary embolism, amniotic fluid embolism, and that you should know. Hypertension, sure. Ectopic pregnancy, hemorrhage, stroke, these are all. But in the United States, the most common is embolism. Now, if you look in developing countries, it's going to be infections, it's going to be postpartum hemorrhage, and so on. All right, let's just summarize by developmental periods what we're talking about. Beginning week 3 post-conception is when the 3 germ layers have developed and we have the embryonic period. The embryonic period ends at 8 weeks post-conception or 10 menstrual weeks. Once all the organs have formed, hyperplasia, hypertrophy will occur, and that is now the fetal period. The fetal period ends at the time of birth. If there is loss of the pregnancy, it will be a fetal death. Now remember, we're wearing 2 hats here. We're looking at the embryologist hat on the one side, we're wearing the public health hat on the other. In the public health domain, it does not become a fetus until 20 menstrual weeks. But embryologically, it becomes a fetus at 10 weeks. The birth to the day of life 28 is called the neonatal period. And we put together the fetal and the neonatal. We have the perinatal period, and the infancy period goes from birth until the first year of life. The government is very concerned about fetal deaths and infant deaths, and mandated by the federal government is a fetal and infant mortality review process, which takes place in all counties across the United States. And I think that's important. All right, that's the end of the perinatal statistics and terminology.